When should I worry about my heart rate during pregnancy? Imagine feeling perfectly fine but noticing your heart pounding faster than usual. That's why understanding your heart rate during pregnancy is so important. It can tell you a lot about how your body is doing. A normal resting heart rate for adults is between 60 and 100 beats per minute. During pregnancy, your heart rate often increases because your body is working harder to support both you and your baby. Usually, your resting heart rate starts to go up around the 10th week of pregnancy. By the time you reach late pregnancy, it might be about 10 to 15 beats per minute higher than before pregnancy. Most pregnant people will see their resting heart rate range from the high 70s to the low 90s beats per minute. But everyone is different. If you were very active before pregnancy, your normal heart rate might be outside this range, and that's okay. Your body adapts to these changes naturally. The reason your heart rate increases is because your blood volume increases significantly during pregnancy, by about 30 to 50% by the second trimester. This means your heart has to pump more blood to keep both you and your baby supplied with oxygen and nutrients. Hormonal changes, especially increased progesterone, cause your blood vessels to relax. This can lower your blood pressure, so your heart beats faster to make up for it. These changes are all normal and help your baby grow healthy. But there are times when you should pay attention. If your resting heart rate stays above 100 beats per minute for a long time, it's a good idea to check with your healthcare provider. A heart rate below 60 beats per minute, called bradycardia, is less common but may also need medical advice. If you notice irregular heartbeats, fluttering, or skipped beats, especially if they happen often or are severe, you should seek help. If during exercise you feel extremely tired, dizzy, or short of breath, it could mean your heart is working harder than it should. Always listen to your body. If something feels off, stop and rest. Staying hydrated and avoiding overheating can help keep your heart rate in a safe range. If you're used to intense workouts, consider lowering the intensity as your pregnancy progresses. You should contact your healthcare provider if your resting heart rate is consistently outside the normal range, if you experience chest pain, severe dizziness, or fainting. Also, if you have a history of heart problems or develop new symptoms, it's best to get checked. Most of the time, a rising heart rate during pregnancy is a normal part of your body's adaptation. Staying active is good for you and your baby, but knowing when to seek help makes all the difference. Always talk to your healthcare provider before starting or changing your exercise routine. Remember, you know your body best. If something doesn't feel right, don't hesitate to get it checked out.